That's what I meant to do, but I forgot. It's all right. Let's see. Ooh, mammogram. Okay. And hello. How is everyone doing? Welcome. My name is Medina, and I am the founder and owner of She Say He Say LLC. I'm also a registered nurse, and today I'm going to be, I actually created this event, and this event is for women and men's health maintenance, health and wellness. And so I'm going to be going over some information to provide the public that I think is important for in regards to like preventative screenings and things that as men and women we should be our goal should be that we're actually, depending on the age, that we're actually, working towards getting those type of tests done, whether it's annually, whether it's every 5 or 10 years, like a colonoscopy. But overall, the goal is for you to stay healthy, mentally, physically, spiritually, stay healthy. Now, I'm going to allow some more people to come. Well, it don't even matter if the people come in because I'm going to do what I do regardless. You know what I'm saying? So I just want to piggyback. This live is sponsored by Boo for Life Terry. She is the owner of One Nubian Queen Accessories. On Wednesdays, which today is Wednesday, she has a Facebook group where at 7:30 every Wednesday, if you join her group, One Nubian Queen Accessories, and it's the number 1, okay? You join her group. She has a live where she sells her jewelry and those types of things. So I wanted to actually showcase, because she's sponsoring this particular live. This is the ring that she sent me. It's a butterfly, and this is sterling silver. And then the band is expandable, as you can see, which is helpful because I'm the type of person who I don't know my ring size. I don't typically wear rings. So this was very helpful to have. And most of her merchandise is $5. These earrings as well. Just want to show you guys that. She provided the earrings. She provided this necklace here. Beautiful, beautiful necklace. I like the reflective part on the butterfly wings. And also thank you, Shirley, you too, love. And also this bracelet. And I love the way this bracelet is because, as you can see, is one of those bracelets where you don't have to worry about trying to, buckle it up like you do with the necklace. You just pretty much put it on and there you go. Very easy, very durable. Hey, love me always. How you doing? Very easy, very doable, and very, very loving as well. So again, thank you. Boo for Life Terry, Judy is her name. Thank you for sponsoring. She is the founder. She is the owner of One Nubian Queen Accessories. Thank you for sponsoring this live for health and wellness for men and women. And also, again, you can follow her on Facebook. She has a Facebook group, One Nubian Queen Accessories. And every Wednesday she go live at 7:30 to sell her products. So thank you so much for sponsoring this live. I greatly appreciate it. The sweater that I have on is Dior, and that's a part of my clothing, the merchandise that I sell. Shop at SheSayHeSay.com. And I want to just, whenever you guys get a chance, if you look at my profile, you'll be able to see the merchandise that I sell. This is actually coming soon, as well as my label sweaters coming soon. But you can have a field day on my profile, and also go to shop at SheSayHeSay.com. That's where you will find the fall and winter collection. I also have a boutique called SheSayHeSayBoutique.com. Everything is $5. Everything must go. Huge sale. Y'all know how I be when you have a liquidation or something going on. Everything must go. Those pieces are beautiful pieces, but everything must go. We're now going into the fall. I have plans to do other things with that website. So everything must go. SheSayHeSayBoutique.com. So thank y'all so much for coming in. I appreciate y'all for joining. And we're going to get into some things, okay? So And the purpose of me actually, hey, Lady of Suspense, the purpose of me actually wanting to do this is because, like I said, I am a registered nurse. And I also feel that a lot of times, this information can be very helpful and beneficial for someone. You know what I'm saying? A lot of times we may not know what tests we need to be doing at what age, what should we be even asking at a particular age, asking the doctor. And I think that it's important that as, hold on one second, suspense in. All right then, Queen, how you doing?
Oh, hello.
Thank you for joining. Thank you for joining.
Thank you for joining.
Oh, you're welcome. I was letting them know that Boo for Life, she's sponsoring this live and she sent me some jewelry. Lord Jesus, come on, y'all, some calls. Y'all, these spam calls is getting out of hand. It's ridiculous. But anyway, Boo for Life, she's sponsoring this live. And so she sent me a few pieces. This is one of the pieces here is the ring, and it's one of the ones that you can expand. So, if you don't know your ring size, yes, these earrings as well. She also sent those, and this necklace, this butterfly necklace with the reflection. Yeah, it's real nice. So I thank her, thank you so much. And like I said, y'all can join her Facebook group, One Nubian Queen Accessories Facebook group at 7:30 p.m. Wednesdays, every Wednesday, unless you get a notice. And she sells her jewelry and everything on there. So what I wanted to do was jump right into what we're going to be talking about today, which is, health and wellness for women and men. And pretty much it's about discussing those tests, those pre-screenings that, is very important for everyone at a particular age. Let's be honest, at a particular age, especially when you get older, it's certain tests that you should be getting done. Preventative tests, preventative screenings is what they call, is actually considered health maintenance. Okay. And I'm a registered nurse, and Lady of Suspense she also works in healthcare as well. And so we want to take this time to just share some of the information. We also going to take a deeper dive, y'all, into, into deductibles, co-pays, co-insurance. We're going to go into a deeper dive into that too, knowing what benefits you sign up for, as well care, knowing, the different things. Oh, something must have happened with that, but knowing those different things as well when it comes to Medicare. What happened? What happened, Lady Suspense? Hold on one second, y'all. She come back in, Lord. She might have got a phone call too. You good?
Good. I'm good. Sorry about
Okay.
My bad.
You all right? No, you all right, love. You all right. So yeah, and I do want to let you guys know that one thing about me as a registered nurse, I'm always going to use creditable resources. I'm never going to use something that hasn't already been evidence-based practice, statistics, and those types of things, okay? But you always want to consult your doctor. Let me make that disclaimer as well, too. You always want to consult your doctor. That should be your first line of defense. Your primary care doctor. Your primary care doctor could be a doctor, could be a physician assistant, could be a nurse practitioner. Whomever that is, you always want that to be your first defense, regardless of anything, because they are the captain of the ship. All right. And I always use that analogy. They're the captain of the ship. They're the ones that's going to direct you to wherever you need to go. Whether you need to see an endocrinologist, you might need to see an oncologist, you might need to see a podiatrist or ophthalmologist, whatever specialty, it starts with your primary care doctor. Okay. So definitely, but I wanted to educate people about that because I don't see an actual doctor. I see a physician assistant. I've been seeing her now for over 6 years. And we have a really good patient doctor relationship, which is very important. Okay. But I'm also going to allow for people to ask questions as well, because what I want to do is I want to educate on how you can communicate with your doctors. Okay. To get the information that you need. All right. So definitely, I definitely want to make sure that you guys walk away. The objective is today is to walk away being knowledgeable about tests that you should be having, depending on the age. Okay. Also, benefit information that can be very helpful to you as well. So definitely thank you guys for joining. I appreciate it so much. All right. And welcome everyone. If we're not able to welcome everyone right at the time, please, we apologize in advance. Once we start getting into some things, we're gonna be getting into some things. So we may not actually see, but we will do our best to make sure that we're looking at the chat, seeing if there's any questions and things like that. So I want to make sure that's clear. All right. So the first thing I want to start with, because this is something that is a heavy topic when it comes to your health and wellness, and it's diabetes. Okay, you have type 1 diabetes and you have type 2 diabetes. Okay, type 1 diabetes, typically you're born with that. Okay, that's something that you really can't. Typically, most of the time, someone that has type 1 diabetes usually have like an insulin pump that they're using to regulate their insulin to them and that type of thing. I'm going to focus on type 2 because type 2 is something that you actually grow into depending on your diet, if lack of exercise. There are other precursors as well. It could be you have other conditions, high blood pressure, high cholesterol, those things as well. And type 2 diabetes is sometimes you may be insulin driven. You may have to take insulin, and then sometimes you may not. It all depends on, everybody is different, and make that clear too. Everybody is different, okay? Some people may need insulin because, it's gotten to that point where taking oral medication ain't working for them to help reduce their blood glucose, their blood sugars. So it's important to ensure that if you are diabetic, and let me make this clear too, I'm not saying people don't know this information. So if you do know this information, great. This is for those that may not know or may need more clarity. Okay. As a diabetic, type 2 diabetic, typically what you are going to do is see your doctor every 3 months or somewhere around there. Your endocrinologist is a specialist for diabetes. You're going to see them every 3 months, maybe every 6 months. It just depends on the severity of your diabetes. And they're going to check your A1C. And your A1C is typically what is going to let them know what is your blood glucose level. And so, like today, I spoke to someone, her A1C was a 12. That's severe because typically your doctor wants your A1C to be under a 7. Okay. So what you want to do, test that you want to make sure that you are actually doing it, your A1C, of course, and having an endocrinologist. You also want to make sure that you're having your eyes checked because diabetes can affect your vision. And also your feet checked as well. Now you may ask, well, why do I need to check my feet? Because diabetes affects circulation. Okay. And so that's why sometimes you may find that some people may need to be on gabapentin, which is a nerve type medication for nerve, because of or they may be on Lyrica as well. They sometimes treat neuropathy, which is where you might feel numbness and tingling in your feet and in your hands. They treat that with Lyrica or gabapentin. Those are just some of the medications. So you may have to take those medications to help with that neuropathy, those needles and those pins in your hand. Okay. So if you don't have no circulation and you can't feel your feet and you're numb, if you were to cut your foot or anything and you don't know and time has went on, you'll mess around and can have a wound, which then gets infected to the point where now the doctor may have to amputate, which is cut off your leg, your foot, your toe. I done seen all different variations. Okay. I done seen someone who was 30 something years old, y'all, African-American male, started with the toes, then with the foot, then with the leg. I mean, just not being compliant. It is very serious. Diabetes is nothing to joke with. It is very serious, and it's very important that you are following your treatment plan and adhering to that with your doctor. Very important. Okay, when it comes to diabetes, even with your vision, making sure there's a difference between getting a regular annual, getting your eyes checked, than getting a diabetic eye exam. There's a such thing, a diabetic eye exam, not just an eye exam. Okay. Hey, Christopher Green, how you doing, love? Hey, Tobias. So you want to make sure. Hey, is it GN? I think it's GN. How you doing, love? Pop love. So you want to make sure that those are the things that you're getting tested for when you are or that you have your doctor is scheduling those tests for you. Okay, regardless if you're doing fine, you're taking your medications, your insulin, regardless, you still want to make sure that you get your eyes checked and have a podiatrist, which is for your feet. The foot doctor is also checking your foot, and you also need to do that. Okay, you got to make sure, guys, that you're involved in your care more than the doctor's involved in your care. And that's very important. Okay? Because I notice a lot of time as a case manager, a lot of people, they want to lean on me to do everything. I can't do everything. You got to be involved in your care, and I'm gonna meet you there. You see what I'm saying? I can support you, but I can't make you or get you to, and I can help try to motivate you, but you got to be more involved in your care than me, because I truly believe when you are involved in your care, this is health maintenance. Okay, y'all gonna hear me talk, y'all gonna hear me say some of the same things, because repetition, y'all, sits in your long term. So it's a reason for that. Okay, you got to say it, see it, hear it. Okay, the more senses you use, the more it's going to go into your long term memory. Health maintenance is very important. You got to be involved in your care more than anybody else, because when you're involved in your care that way, I feel that empowers you to be compliant, to do what the doctor is asking you to do. Okay, the doctor ain't just saying stuff just to be saying it. Now, if you got some doctors that just ain't helping you, and you feel as if you're being talked down to, degraded, of course you want to look for another doctor. You don't want to continue to have that type of relationship, because you're not going to hear anything. Okay, it's also okay for you to tell the doctor when you in that office with the doctor, and the doctor is rushing and going 50 miles an hour, when there's some things you don't understand. It's okay to interrupt the doctor and say, doctor such and such, I know you said a lot of things. Can you explain this again? But can you make it plain? Can you help me understand it a little bit better? Ask those questions, y'all, because I'm going to tell y'all something. Healthcare these days is totally different. A lot of times these doctors is trying to get that cash flow. The quicker they see you, the quicker they get you in and out. You got to be the one to take command of the moment that you have, because you're paying for a service. So you got to take advantage of that moment. Okay, don't let the doctor just push you aside and just hurry up and get you out the door and you don't understand something. No, you don't understand something, explain it, let them know, it's all in the tone, and just say, hey, I don't understand this, can you explain this more simple terms? Okay, you're gonna have to give it to me elementary. I'm just saying, because some medical terms, I'm a registered nurse, shoot, I still can't pronounce some of these medications and diagnoses. Okay, I spell it out. I'm just saying. Lady of Suspense, anything you want to add to that? Shoot.
Just take care of yourself and also be your own advocate. If you're like Dee was saying, if you have a doctor that's dismissing you and talking about, it's not as bad as you're saying it is, things like that, get another doctor. Find that you're compatible with. And I've had to do that myself. So
Me
yeah,
too. Me
because I
too.
probably would have been paralyzed if I had kept seeing this doctor. Yeah, it was back from when I had my back issue for from the first back surgery that I had. And I was telling him, hey, something's wrong with my leg. I couldn't walk. My daughter had to take me into the doctor's office in a wheelchair because I couldn't walk. I was in so much pain. And he just was like, well, let's do physical therapy. And let me give you these meds, which the meds didn't work because I trusted him. And I went back and forth to the doctor within like a 2 month time span. And each time I would go back, he would just give me drug test. I guess
Mm.
thinking I was drug seeking, but literally I
Mm.
not walk. I was in that much pain. And so finally I had to cuss my way into it, but I was finally taken seriously, had an MRI, and it showed that my disc were bone to bone, and it was
Mm.
squeezing my nerves in between. So I had the first surgery, and then so I had after that surgery, I went back to the doctor because after the surgery, I was told I would be back to normal. And I wasn't. I was still in a little bit of pain. It was better, but it was still painful, but I could walk, so I didn't really think much of it. So a year goes by, then I couldn't walk again. So I went back to
Mm.
the doctor and I was like, hey, I can't walk again. This hurts. And I did the cussing out thing. And they was like, oh, let's just do physical therapy. So I was like, okay. So I did physical therapy for a couple of rounds, and instead of getting better, it was getting worse. So went back to the doctor, of course, drug tested again, and did some more
Mm.
cussing out. I had to rule at them at that time. And so I
Mm.
went and I called my health insurance um, advocate, an advocate from my health
Mm.
insurance. So I
Mm.
explained um, uh, what was going on and what I've been through and how I'm not taken seriously. That hey, I can't walk and I'm starting to get foot drop,
Mm.
and which is where you can't move your
Mm.
foot. So after the advocate called the doctor's office, they called me the next day or the day after and scheduled me for an MRI. When I had the MRI, finally, it was shown that the place where I had my first surgery, the vertebrae, had gotten worse. And so
Mm.
this my disc was coming out. So it was ruptured, it was a ruptured disc, and it was bone to bone again. So with that second surgery, it fixed everything. I was able to get the pins and rods and the cage, and they fused my lumbar.
Mm.
So so with all that said, what I mean is if you feel something isn't right and your doctor is blowing you off, be your own advocate.
That's right.
Because if I was to have waited longer, I would have been paralyzed. Listening to this doctor, believing that this doctor was, knew what he was talking about. I was like, oh, I just need to go to physical therapy, or oh, I just need to change my medicine. And if I had done that, but I still felt, Brennan, I still felt as, as if something was wrong. I had to get reinforcements. So I'm very thankful that, my insurance company, my
Mm.
insurance company, was able to step in and help. So,
Well, that's good. That's good. And the key word is the advocate. The health advocate was able to help you as well too, which is something that we'll get into more about when it comes to case management. Health advocates. It's different names. There are different names for those for a health coach, and those type of things. So, but I'm glad you was able to get what you need. And I echo when you say advocate for yourself. I'm trying to tell y'all, you better advocate. You better be the cheerleader for your own self versus somebody else, depending on somebody else. So not only does that happen in just your daily life, it happens in reference to your health and wellness as well. Be your own cheerleader. I mean, because a lot of times, and statistically, and I have to say this because this is what it is. Statistically, African Americans, especially men, may don't feel as though they are being talked down to or degraded, or so that's why a lot of times they don't go to the doctor. Okay, and so that's what my focus is to didn't you speak on that before in a previous message? What you mean, Christopher? I'm speaking on it again. Okay, now let me say this, my God, today Let me say this.
I'm,
This,
I'm being nice today.
this is an informational thing. I'm a registered nurse. I'm going to always talk about things, the same things sometimes. Okay. And if someone doesn't want to hear something that I've said before, you got 10 fingers. 10. Take both of them 10 fingers and swipe up and take your ass up there into the sky, and you can sit and watch from the sky. Okay? That's what you do. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take all 10, swipe your ass on up out of this live or go somewhere else and sit your ass up there in the sky like everybody else do. Okay? I hate to be like that, but sometimes I got to be like that. Okay? Okay. Now, let's go. So thank you so much, Lady of Suspense, for sharing your personal experience, because and that's something else too. Your own personal testimony can help someone else out as well. All right. It can help someone else out as well who've been through the same thing. And something that, because I'm gonna say this as well too, because now we're in a time where they have categorized an opioid crisis, okay, and those type of things. A lot of times when you go to the doctor, they may feel as though you are, we call, when I was an emergency nurse, I started then, we would call that frequent flyers, okay, who would constantly come in, and they would come in with different things, and it was categorized as drug seeking. And this is how I feel about this situation with the opioid crisis. I feel that your doctor should have the wherewithal, the relationship to know whether you are someone that has that type of behavioral. You see what I'm saying? It's all a behavioral type of situation. Your doctor should be able to determine that. Okay. So if you have a doctor, okay, that's telling you, oh well, I gave you this, I gave you that, and then you feeling as though they treating you as if you're not, I'm saying, like you're drug seeking or whatever, don't curse them out. Don't do that, but have a conversation with them, and then go ahead and see someone else. See, what I do is, when I'm going to the doctor, see, me and my doctor have that relationship. When I go to the doctor, I'm automatically letting that doctor know what I need, because I know I've tried different things. This ain't working. So this is what I need. So because my doctor know me for 6 years, my doctor know I'm not that type of person. I don't have that behavioral trait to be seeking any type of drug or abusing that. She has no issue. Same thing with my OBGYN. If I'm cramping or whatever the case may be, I could simply send a message and automatically I'm prescribed what I need, because they know that I'm not the type of person who's going to do that. So that's my thought in regards to the opioid crisis and the doctors and these laws that are being put in place. Now, I will say this, okay? I will say this. Insurance companies do have restrictions, okay? And we're gonna get into that a little bit more, because that right there I really want to get into, because insurance companies, just keep that in mind, Lady of Suspense, in case I forget. Insurance companies, they do have restrictions on pain medication. All right. So I just want y'all to keep that in mind. So, because some of y'all be ready to curse out the customer service representative, and it ain't the customer service representative fault, it's your employer. But we're going to get into that in a little bit. But we're going to finish up with the diabetical sign. We're going to finish up with the diabetes, okay? Then we're going to go into some other things. And then we're going to spend some time, probably more time, on the education of your benefits, because I think that's very important. Very important to know the benefits and what you have to be able to get what you need. Okay. All right. So, like I stated, with diabetes, okay, you're going to have an A1C blood test. Now, y'all going to see me looking over to the left. I'm looking over to the left because, again, I like to read things verbatim. I'm not the type of person that's going to be telling y'all anything. I'm a registered nurse. Okay. I must use creditable resources. Okay. So you're going to have your A1C blood test. You may have to take that every 90 days. You may have to be every 6 months. It all depends on your blood glucose level of what that is. So your A1C blood test is going to show you whether your blood sugar has been staying within your target range. You want to contact some of these things. I'm going to refer y'all back to your doctor. Okay. You want to contact your doctor because, for example, like high blood pressure. High blood pressure is elevated when you're in pain. When you're in pain, your high blood pressure is elevated. Okay. So just know that. However, if you're someone who has high blood pressure, a normal high blood pressure, and I'm just going to say, like, for me, Like I don't have high blood pressure, but let's say my blood pressure is like 140 over 85, and it's always around there. That's my norm. Okay. So understand there's always going to be a range that's considered the normal and something that's considered elevated. You know what I'm saying? Not normal or abnormal. So if my blood pressure stays around 140, I can still take blood pressure medication and my blood pressure still may never get under 140 over 85. However, that's the norm for me. So you want to know, what is your normal blood pressure? When you go to the doctor's office and that doctor, that first person you come in contact with typically, and I'm talking about a primary care doctor, okay? Family practice, something like that. When you go to the doctor's office, they're going to check your vitals. They're going to check your weight. They're going to check your vitals. They're going to do those type of things. Now, they may do some blood tests if it's a wellness, if it's an annual visit. They may go ahead and do a full workup panel and everything like that. Ask them, what's your blood pressure? Well, what's my blood pressure? What's my pulse? What's my respirations? Get those numbers so you can learn and you can know what your normal is for you. You know what I'm saying? You can ask them. Okay. Typically it's like a medical assistant or someone else who will come in and take that for you, or LPN or something like that if you're in an office setting. Ask them, what is it? Oh, what's my blood pressure? That's what I do. What's my pulse? What's my respiration? What's my O2 stats? That's your oxygen level. That's very important for patients who have chronic obstructive pulmonary disease, COPD. It's important that you know your vitals as well too. Okay, come on, y'all. We gotta do better with that. Now, also having your cholesterol checked, that is a must. Let me tell you something. Let me tell y'all a story about my mother. My mother has sarcoidosis. I may not be saying it right, but y'all can Google some kind. Just go to your phone and say, look up sarcoidosis, okay? And it should tell you, all right? It attacks her organs. For her, it attacks her vision and her lungs, okay? But she also has high cholesterol. Now, she wasn't taking her medication for a while, but we didn't know. But she kept saying that she kept having these spells, falling out, passing out, fainting in the store, fainting here, fainting there, her boyfriend having to catch her, somebody having to catch her. She kept having these spells until one day, this one really did it to where they had to send her on to the hospital. Get to the hospital, she was having many strokes. The doctor said if she didn't get there when she did, that next one could have been a massive stroke. Reason being is because she had the plaque build up. See, your cholesterol is dealing with plaque. That's why they tell you, like with fatty foods and stuff like that, to be mindful of that because it clogs up your arteries. Okay. And here in this area here, up in this area here is where it was clogged. It was to her brain. Okay. Because if you ain't getting no circulation to your brain, what you think about to happen?
Ain't gonna be good. That's a stroke.
That was clogged up because she wasn't taking her medication, which is statins. STATINS, statins. Atorvastatin. They got different types. Pravastatin. They got exactly, Christopher. Not only that, she could have had a massive stroke and passed. God, I'm glad she's okay, and we got everything situated. Now she take her medication. But just in that little bit of time, it built up. The plaque built up in your arteries, okay? Circulation. Y'all, the veins in your arteries, all these different things is circulation. And if you don't get oxygen to where it needs to be, that's a problem. All right? That's a problem. So please have your cholesterol checked because you got the good cholesterol and you got the bad cholesterol, and it needs to be in a particular range. Your ADL and your LDL. It needs to be in a particular range, okay? Now, some of this information I'm not going to be able to provide because we'll be here all night. I'm just going to be real with you, and I ain't trying to be here all night, y'all. So I want to be able to give y'all the points, because not only that, y'all know I like to do other things on TikTok. So but 7 o'clock is where we cutting off, and we might just turn up after that. But right now we're trying to be serious, okay? So you got to make sure that you're getting those tests, your cholesterol tests, your blood pressure tests, okay? If you're a diabetic, make sure not only that you're having your A1C checked, but you're checking your blood glucose levels. All right. There's a such thing called, I know when I worked in the ED, as protocol, because we would have people that would come in who blood sugars would be over 800. And they still walking and talking like they fine. Now that can take you in a diabetic coma. But some
Man,
people, they'll be talking 1 minute and then they die the next minute. I never forget. I was working in the ED. I never forget. I remember the nurse took the patient. The patient said they had to go to the bathroom. The nurse took the patient to, she helped walk them to the bathroom. Blood glucose was 8 something. It was something like that, 8 something. Next thing I know, when she closed the bathroom door, we heard a boom. Hey, Herb, how you doing, love? Walked in that bathroom, that lady died. Y'all got to be I'm telling y'all what I know.
take care of
What you mean,
yourself.
Herb? We've been here. What you mean you miss us? We've been here. We've been here the whole time. Where you been, brother? Okay. We always been here on the get down. Okay. We miss you too. We love you too. Where Coffee at? How's she doing? She doing good? So coded, right, Christopher, right, Christopher. Look at Christopher trying to be all healthcare related and whatnot. I see you, Christopher. I see you trying to come on the good foot. You said, "No, I ain't about to do no swipe. I ain't about to do the swipe and take my ass up in the sky." Christopher, I'm getting ready to Google some. Christopher said, "I'm about to Google some healthcare stuff because she ain't about to kick me out."
You can
He
stay,
said,
Christopher. You can stay.
"Oh, that's good, Herb. That's good." So you definitely want to make sure. Hey, Ansley, you definitely want to make sure that y'all getting these tests done. Your mammograms. If your family has a history of have a history of breast cancer. You want to make sure you talk to your doctor about that. Hey, Candy, because your doctor may want you to have a breast mammogram sooner than later. You
Hi,
see what I'm
Ann.
saying? Hey, love, how you doing, Ansley? So you definitely want to check because, and I'm gonna tell y'all, if you have a history of cancer, any kind of cancer, your doctor is probably going to, please, let me tell y'all something. I know when you go to the doctor, you have all this paperwork they want you to fill out. They want you to tell what your mama had, what your brother got, what your sister got, what your father got. It's very important, y'all. It's a reason for that. Because if they see that there is something that's a common situation in the family, your doctor is going to pay attention to that. Your
Yeah.
doctor is going to treat you a particular way because of that, especially if it's dealing with blood pressure, diabetes, high cholesterol, COPD, cancers, and all that kind of stuff. Your doctor may say, okay, listen, typically we would do this test at 45. Well, because you have a history, we're going to do this test at 35. You see what I'm saying? So it's important for you to update that information. Yep, family history. That's right, Ansley. Family history is very important. It can save your life. You'll be surprised how it can save your life because it's going to alert your doctor to look at things that they typically would not look for, even though you're healthy. If you have like for me, because my mother has sarcoidosis, I also have certain things that the doctor is going to check for regardless because of that. You see what I'm saying? So you want to make sure that you are filling out that information. I know it could be a hassle. I know it can. They give you them little bitty baby lines, can't hardly put number 2 letters on there. Turn around on the back and write on the back. Okay? Y'all know how you used to do when you had a test in school and at the bottom it say, go to the back or turn to the back. That's what you do on them paper when you're doing all that medical paperwork. Put on there, look on the back. That's what you do. I'm just saying. I'm serious.
When I was going through my breast cancer, and
Mm-hmm.
it was at the beginning of everything. And
Mm-hmm.
as going through all the biopsies and stuff, my doctor had me take the genetic gene test. And the results came back that I was BRCA two
Mm.
um, positive. So that was also reconstructed to my father's side to where two of his sisters had breast cancer at a young age because I was in my early 30s
Okay.
when that went down. So I wasn't supposed to have the mammograms or anything because back then it was like you had to be 40 to have it
Mm. Mm-hmm.
really, until after like I said they were doing the biopsies and they had the test and then the results came in. And then so that's when everything kind of changed because of the family history,
Right.
because of that.
Right.
And then not only my two aunts had breast cancer, one of them had passed away, but all of their daughters had it
Oh
as well.
wow.
So it was
Mm.
kind of destined for me to do it. So after my treatment was complete, I had the double mastectomy, and I don't have to have mammograms anymore, but it's still advisable to at least get them checked
Right.
and still, redevelop,
Right.
again after all that. So yeah,
Right.
so I have I have
Wow.
there's a t-shirt that I used to wear that says something like, "Yes, these are fake, but my real ones tried to kill me." So,
Mm. Wow.
so
Okay. But you know what? It is. But you here. That's all that matters. And what you did, your doctor did was more preventative. There you go. You see what
yeah.
I'm saying? Preventative. Because this is heavy over here. So this is what we recommend and we encourage. And sometimes your doctor will do that, ladies. If you have a history like that, they'll recommend you have the mastectomy or whatever, for both. They'll recommend that. So definitely, take heed to that. Or if you're someone in the family that will continuing to have cervical cancer or different things like that, they may recommend you have a hysterectomy or something. You know what I mean? So just know that, man, men and women anatomy is something else. You know what I'm saying? But the main takeaway from it is make sure you're getting your preventative tests, your mammograms done, your colonoscopies. I'm gonna tell y'all something right now. It's important to get these colonoscopies, okay? It's definitely important and making sure that you get these colonoscopy because you don't want it to be to where it's too late. All right. You don't want it to get to a situation where it's too late, where now all of a sudden you have some cancer, the metastasize, et cetera, et cetera. So definitely make sure that you're getting that done. Men, make sure you're getting your prostate. I know y'all don't want to do it. I know it may seem uncomfortable. Okay. If you need a man, if you need a woman doctor, you prefer a woman doctor over a man doctor, then do that. It's a necessity. It's embarrassment. It may be, but you rather be embarrassed than living than dead, and you can't feel nothing. You understand what I'm saying? So definitely get those things checked. All right, it may be a little bit uncomfortable and things like that, but it's necessary. Okay, it's a necessary embarrassment. That's what you're trying to say, Christopher. I got you now. Most definitely, most definitely. So please, y'all, go get these things checked out because I just feel like go ahead. Go ahead,
So I
lady.
have when going back to family history and everything like that. Um, I am needing some advice on how to talk my daughter into getting herself checked because I explained the history, my history because I even though I had only went to stage 2, it's still there, and then it's also shown in uh, the genetic testing that there's that BRCA gene mutation. So once all that was going on, my daughter, she was, much younger. She's 22 now, so she was around 12 or so at that time, and I'm really concerned because she refuses to get herself, even the genetic testing. She won't get the mammogram or anything like that because of, the family history. She does qualify for mammograms at being such a young
Mm-hmm.
age, with her
Mm-hmm. Yes,
being
she would. Mm-hmm. She
so.
sure would.
And I don't really know what her reasoning behind it because, like I said, she was 12 when I was going through the chemo and the surgeries and things like that. So I don't know if that kind of went to her, to her mind, that
Um,
her, but I'm like, you need to take care of yourself. And I
right.
can't go. I can't get her to go for nothing.
Well, have you, because something Christopher said was remind her of the consequences of not doing it. And that's something too. Um, have you offered to go with her?
Oh yeah, absolutely. I even told her to go to my doctors. They're still around. They're
Hmm.
still doing things. So they probably got better over 10 years, you know what I'm saying? And they
Right,
did good.
right. So she never have said, like, when you've asked her, well, why don't you want to? Can you see that? See, this is a great question, Lady of Suspense. I'm gonna tell you why. Because it's so important for us to learn the method of using open-ended questions to obtain information from someone versus closed-ended questions, which will restrict information. You know, because like if you said, well, why won't you go? Because I don't want to.
Hmm. That's
Explain to
basically.
me, but if you said, explain to me reasons that may be preventing you to want to go to have the test done. That is not a yes or no. It's gonna have to be because X, Y. You see the difference? Y'all see that, peoples? The difference in those two things, and where they're saying, well, why you don't want to go? Because I don't want to. And then sometimes it can make that person, because of her trauma that she may be experiencing, from when she was young, seeing that and seeing what you went through, that could be what is hindering her. However, she's not open to discuss. But if you asked her, explain to me reasons that may be preventing you from wanting to go, or explain to me reasons that are preventing you from wanting to go. Explain to me reasons, them three words. That's going to now cause a communication. She's going to have to explain or state something. And then I think that's going to be able to give you those answers, because one of them may be, well, Ma, when we was going through that when you was young, that really traumatized me. So once you find that out, and that's the reason, now you can getting more information and helping her to know and explaining to her the feeling and kind of allowing her to be open to hear what you went through, because even though that she may have seen it, she still haven't heard it, like as far as having more of a verbal communication about it. You know what I'm saying? About what you went through and why you're feeling a particular way. So definitely I think that would be a good approach to get her to, get her to open up. That's one thing that I can say with people, um that for me, I know when I'm talking to, um if I've been a Karen testing. Yeah, she did it. She did tell her, Ansley. But that's one thing that I do when it comes to my patients, especially when oh boy, men is something else. However, I will say, when you use that approach, and it's called motivational interviewing skills, okay, it is a skill. When you use that approach and you use the way in the way that you present the question, how you present the question, that opens that forces, not forces, but that promotes the person to open up more about why they feeling a particular way. You know what I mean? And it also allows you not to judge, because again, like for my situation, when people say certain things with these doctors and they feel already judged, I don't want them to feel judged. I want them to open up to me. So by me having those questions and stuff, we're asking those open-ended questions, it helps me to build that trust with them too, that I'm not trying to harm you, you know. I just want to help you, and this is ways that I can help you. You know what I'm saying? So I think stating that um probably may be helpful. And she's young, and I get it. Some of that is, I'm 22, and everything. I get it. But sometimes it's also helpful to have her hear from someone else too. Because when we hear sometimes from our parents, we already have this, as we're very rebellious with our parents. Our parents tell us stuff and to do stuff I don't feel like doing or whatever. But if you actually hear from someone outside of that who has no rhyme or reason, no connection like that, she may receive the information better. You see what I'm saying? She may receive the information, and then hopefully that's going to allow her to go ahead and say, you know what? Because I can tell you one thing is fear. I can just tell from what you were stating and what you went through and her being so young, there's some fear there. There's some fear there. It really is. And it could be because sometimes people don't, sometimes, and this is for people who may have an ache, but they just keep on saying, oh, I'll be okay. And that ache keep getting worse and worse and worse. Sometimes people don't want to know, but not want to know can also be the difference between you being here and being gone. You know what I'm saying? Not saying that with your situation. I'm just saying as far as like when I talk to members about certain things, you need to get that checked out. You've been complaining about this. Like for me, I know my shoulder, I got to have surgery. Okay. I already know because y'all, this finger right here, feeling a little bit numb. I'm not going to lie. So that's letting me know that the circulation, I have a pinched nerve in my neck and the circulation is now starting to hinder. So I already know that my next thing is to make an appointment with my doctor so that I can go and get this checked out. But I already know what they're going to say. My doctor, my physician assistant going to say, Miss Taylor, the orthopedic going to say, surgery, we're going to have to go ahead and schedule to have surgery to correct that because it's causing the swelling, the pain, and my hand feel like it's sleep. You know what I'm saying? It feels like it's sleep. So that's that circulation as well. Hey, Mary, how you doing, love? So definitely you want to make sure that you get tested out regardless. And I'm the person who I don't care if I got a headache, I'm quick to go to the doctor now. That's one thing about me. I'm quick to go to the doctor. I don't play no games, okay? About my life or my daughter. My daughter tell me something going on, let's go same day. Or if not the next day, going to the doctor. So definitely, just with that situation with your daughter, I would definitely just, come approach her that way or look into, seeing if someone else can talk with her and possibly that can help guide her to make that decision to go ahead and have the mammogram. And mammograms are uncomfortable. My God, today. And I'm going to tell you something else too. If it's your first time having a mammogram, 9 times out of 10, they're going to make you do a 3D one. They usually have you come back and look at whichever one, because when it's your first time, the doctor don't know that, okay, one breast may be a little bit bigger than the other. One breast may have a little bit more tissue than the other. The doctor really don't know that. So when they do those tests and they see that one side is different than the other, automatically they're going to call you back to take a deeper dive into that breast to make sure there's nothing else that's going on. That's typically what happens most times when you have your mammogram. So please, ladies, when you have your first mammogram, don't get scared and nervous, because I know I did. I ain't lying. I was like, wait a minute, hold up. But when I did my research, oh, okay, so this is normal protocol for them to do it again if they notice that there's a different variation between the two breasts or something like that. Okay, but I get my mammograms, my pap smears, and my mammograms. I get them things done. I got mine coming up in October. I don't play no games. I definitely do, because I'm trying to be here. It's important. Your pap smears too, ladies. Your pap smears too. Depending on your history, you may have to go every year or every 2 years, depending on your history. If you have a history of where you might have had some abnormal, God Lord, what is it? What am I trying to say? What's the test that they want kids to get now? The vaccine.
HPV.
That's it. That's it. If you had a test that had like abnormal stuff or something like abnormal cervical cells, that's it, Ansley. If you have a test or something like that, then you may have to keep going every year or something like that, because the doctor want to make sure. They'll probably do a biopsy, and it's called a LEAP procedure or something like that. They'll probably do a biopsy test to make sure there's not any kind of any precancerous cells or any cancerous cells or something like that. But typically after that, you got to go often until you have a regular pap smear, meaning that the pap smear comes back as normal. But if the pap smear comes back as abnormal, they're going to have you come back more frequently than a typical time for you to come back. Okay, so definitely make sure that you all are doing that. Men and women, colonoscopies are very important. Colon cancer, boy, I tell you, it's a lot of people that's passing away from colon cancer. Get checked. And I think it's every 10 years for colonoscopy. It's every 5 or 10 years, depending for colonoscopy. And what they do is they remove the polyps. Okay. And then they're going to test the polyps to see if it's any kind of precancerous cells or anything like that with the polyps or whatever. And then that's when they'll let you know, no, there wasn't, or yes, it was. And that's what happened to Will Smith. If y'all don't know, he had finally, at 50 years old, he finally decided to have a colonoscopy done. And then when he did go, because his doctor been telling him that he need to go get it done. When he decided to go, when the doctor called, they actually did find precancerous cells in the polyps, which meant that if they didn't catch that when they did, he may not be here to get to slap nobody. You see what I'm saying? I'm just saying. Okay, now y'all let that slide, let that go over your head. Okay, don't take a deeper dive into that. But I'm serious. He might not have been here to slap Chris Rock. Okay, but they caught that. And then here we come with the slap. All right. So definitely it's very important. And he broke down too in that moment. He was filming. Y'all know he do that thing on YouTube. He was filming. And when he got that news, it did something to him. He told him to cut the cameras. And I already knew he probably broke down. And then after that, Jada went to get hers done. All right. She went to get hers done and whatnot. So it don't matter if you're a celebrity or it don't matter if you're a celebrity or not. Go get your test done. It's very important. All right. It don't matter. These illnesses ain't got no name, rhyme, or reason to what's going on. You got to go make sure you're getting your tests done, and everything. So those are just a few things that I wanted to talk about. I'm definitely going to be doing these things a time or two. And so what I want to get into next is, when you have insurance and you have commercial insurance, and then you got your Medicare. Some people may have Medicaid. Okay, we're going to talk about this commercial insurance because I think it's very important for the people to understand your copay, deductibles, and co-insurance. Okay, because there are a lot of people. Hey, Cindy Cat. Hey, Black Mama. There's a lot of people who don't understand, and then next thing you know, you get a big bill, and you want to call customer service, and you want to curse people out. Because you got this enormous bill and your insurance said this and your insurance said that. What did you read it? Okay. I do want to say this. Commercial insurance, your insurance, the insurance company ain't got nothing to do with what your employer agrees for you to have as your insurance. Okay. Your employer is the one who decides what company they want to go to and who they want to service to provide medical, vision, and dental coverage. They are also the ones that have this agreement with whomever, to say, okay, we're going to provide this, and this for benefits. You see what I'm saying? Hey, love, we're going to provide this, and this. That's who determines that. Now, there's also a such thing as appealing, which means if you get something that's not covered, like this, and this, then you can appeal. However, sometimes you get it approved and sometimes you don't. Okay, because again, if it ain't covered, sometimes it's just, you can go through the process, but it ain't going to be cut. It's not going to be, approved. And that's just what that is. Okay. But I'm going to let Lady of Suspense, and I'm going to chime in with Lady of Suspense, but I'm going to let Lady of Suspense, do you feel comfortable, Lady of Suspense, describing the co-payment, the co-insurance, the differences, and the deductibles?
Okay, I can try.
Okay, and I'll add in. I'll come in and add in, which let me go get my glasses too so we could be twins. Hold on one second. Wait a minute now. Hold up. Wait. Oh, shucky, ducky, quack, quack. boom, boom, dicka, boom, boom, a dicka, boom. What? You better come on. Yes, God, y'all. Listen. Okay. Now, y'all know I gotta have some people test my stuff out, okay? But it's a sentimental reason behind the gift that I gave her, the Burberry sweater, okay? And I have on the Dior. But let me go get my glasses right quick, y'all. And then we're gonna get into the co-insurance and all that. Hold on one second.
All
Lord
right.
knows I can't.
Yeah, the sentimental reasoning that Dee was talking about from when I, was chosen to test the Burberry sweater is my mom. She was the biggest fan of Burberry. Oh my goodness, she had it all: purses, clothes, jackets, everything. She just loved it. And my mom passed away in the beginning of 2021. So when Dee was talking about the labels that she was about to, test out, and and she said Burberry, and I told her, I was like, oh my gosh, my mom would have loved that. And so when I got the sweater and I looked at it, I was like, yeah, this is Mama right here. She would rock this. So now I'm rocking it in her honor. That's
Yes,
what
God. Yes, God. Hey, Simply. Yes, God. And we all about to be rocking in a little bit because they on their way. Okay. Yes,
right.
Lord. Okay. So, okay, I got my glasses. Let's see.
All right, there we go.
Okay, I got
Now
my
let's just,
glasses. So I'm gonna let Lady of Suspense explain your co-pays, your deductibles, co-insurance, and then I'll fill in the areas as needed. Okay, take it
all
away.
right. All right. So there's three levels of your insurance, your medical insurance. That's your deductible, your co-insurance, and your out of pocket. So what happens, because we all know that's, and it kind of really depends on what the company and the insurance company negotiated on what all those amounts would be. So it can vary. It can vary. There's literally thousands and thousands of different plans.
Yes.
And with each company, it could be 100 different plans that's available for their employees. So if if you hit a certain amount, if you go over the out of pocket, that's when the insurance starts paying at 100%. Now, here's where a lot of people kind of get like a sticker shock, you know, after you hit your deductible and you're thinking, okay, the insurance is about to start kicking in at 100%. That's not the case because after let's just give an example. Let's say you had a $500 deductible and a 20% co-insurance and then 15,000 out of pocket. What happens is after you've paid that $500, you're going to still keep getting bills because of that co-insurance, because your co-insurance comes in after your deductibles hit. And you are sometimes, most of the time, is 20%. So you're responsible of 20% of the doctor bills that you get, MRIs, whatever that is, until you pay up to that $15,000, which is your out of pocket. Once you do that that $15,000 out of pocket, then that starts going where the company pays, or not the company, the insurance pays it
Going to
100.
pay 100%. Yep.
Yeah, because a lot of people don't understand that, hey, I just hit my deductible. I paid up my deductible. Why am I still getting this big old bill from each doctor? Well, it's because your co-insurance is kicked in. And then
Hey, well, Harvey.
sometimes those co-insurance also have a co-insurance with the co-insurance. So it'd be like, for instance, I mainly work with transplant patients. So sometimes with this particular type of coverage, there's a $500 copay before you start getting the co-insurance kicked in. So, and that also leads me to the point of different insurances or different packages, different plans. When you get that option, when it's time for open enrollment, look and read closely what the plan is offering, because sometimes a lot of companies will choose these plans that are very cheap to you. Let's say, like I said, the 500 deductible, 20% copay, 15,000 a day. They might offer something with zero deductible, 0% coinsurance, and zero out of pocket. But
Mm-hmm.
it won't cover what you need. It's very bare minimum, which I
Hold
mean,
on one second. I'm sorry,
uh-huh.
y'all. While Harvey in the building. Hey, while Harvey love, how you doing? My God, today. Okay, go ahead. Go ahead. I'm sorry.
Oh, you're fine. And I forget where I was.
The
Why Harvey?
co-insurance.
Why Harvey got me excited? I forgot.
Mm-hmm.
Yes. Um, the let's see, where was I? Oh, the different plans. Um, Pay attention, especially if you know that. Let's say you pick a plan that's affordable for you, and let's say you broke your leg. This is all an example. Not saying that there's plans like this, but this is just an example. Let's say you
Mm-hmm.
broke your You go to the doctor to get your leg fixed, and then you come back home and you see this huge bill for $1 million. And you're like, hey, why? I got insurance. Why is this $1 million? Well, if you look into your certificate, which is your plan, if you read through those pages, you would see that there's a section that says will only cover arms, broken arms. And so then you're stuck with this bill. So
Mm-hmm.
it's very, and, if I was to give advice, I would be like, when you're at open enrollment, look very closely to your coverages that are being offered, because
Read, y'all. Read.
and these certificates, they are hundreds and hundreds of pages long. But with today, I think today, because they used to mail them out to you, but I think now they can email it to you if you request.
They don't do a whole lot of because the paperwork and stuff. So they do that
Yeah, yeah.
mailing and or go. You got to go on your company website and
Hmm.
look at them and all that kind of stuff. But no, you do need. I'm gonna tell y'all something else too. And the reason why I brought up colonoscopy is because there are some plans where it'll have an exclusion. It'll say we'll cover you 100% for the colonoscopy.
Hmm.
But if we remove polyps, that's now no longer preventative.
Right.
So you got to read that because
Hmm.
I worked for an insurance company before, and I remember seeing that, and it's like, well, your company said we'll cover for the colonoscopy, but then we ain't covering if we had the polyps removed. I'm just saying. So you got to make sure you are looking at and reading in detail. Ansley, what Harvey in here, love? Did you speak? Uh-huh. Hey, Kennedy Smith. So that's why you want to make sure, that you're reading what is, and don't just think just because you got something one day or you had some one year, you're gonna have the same thing. Stuff changes. The title may be the same. You see what I'm saying? The title, the name of the plan may be the same. Who it is this Candy Smith? We're just an educational moment right now, Kennedy Smith. I'm sorry. We're not letting anybody in the room right now. It's an educational moment. I'm sorry, love. But you can ask your question in the chat, okay? But you want to make sure that you're reading in detail. And also you want to make sure that you are like, if you know one year this is what was going on, make sure you're looking to see if whatever you needed last year is in the plan you're gonna pick for this year. Does that make sense? You know what I'm saying? Don't be just saying, oh, I'm just gonna pick this. Cause sometimes cheaper don't mean it's better when it comes to now. Let me throw some out. Now, these imitation sweaters. Oh yeah, these are nice. But we talking about look at that. But we talking about health and wellness. Okay. So definitely when it comes to the plans, don't be thinking just because, because a lot of times now these insurances, I'm gonna tell you what they're doing. They're doing these high deductibles, like Ansley was saying, they're doing these high deductible plans, $67. But your deductible as a family, about 15,000. 20,000, 30,000. You know, good and well, you ain't gonna never probably meet that if you somebody that's healthy and God, hopefully you don't have to. You know what I'm saying? A lot of times, them PPO plans that have those co-pays, those are more expensive.
Hmm.
Those are more expensive because you only got to pay a $25 copay and then insurance covers whatever else. See what I'm saying? So it's different. But them high deductibles,
You
if
pay
you
it.
by yourself, it's one thing. But if you got a family, oh,
Hmm.
it's everybody. It's the family
Yeah.
the deductible that you're gonna have to meet. And a lot of times you're not meeting that. So that's why you can then choose to have a health savings plan or a flexible savings plan to where sometimes your job will contribute um
Mhm.
or you can contribute as well into that. So then when you go to the doctor, you can use that card with the money that's been provided to you or the money you've had coming out of your check to go on it to pay for your medical bills, prescriptions, stuff like that. But yeah.
Piggybacking on the family deductible
Hmm.
information, that's another thing that you would have to read the plan's certificate about because it depends on what it is. Like, for instance, with transplant, some of these plans would have it to where if it is a family plan, the deductible, coinsurance, and out of pocket would be on an individual basis. So if an individual plan is $500 in a deductible, and the family deductible is $10,000, for a transplant, they would just have to meet that 500 deductible, and it's written out in that plan. So that's another reason why it's important to read because certain procedures, certain things are covered differently compared to um, the main part of the medical, like skilled nursing facilities, um, rehab. Those are different as well. Let's see what else I usually see. Well, because of the change in the I don't know if I can even say abortion, but I just did.
Hmm.
In the laws with that, that used to be part of the insurance as well.
Oh
And
yeah.
so they had to
Yeah.
change
Now.
what's going on. That used to be part of the insurance as well.
Oh
And
yeah.
so they had to
Yeah.
change
Now.
what's going on.
Right. Now, Christopher, you asked a great question. You said, what is the difference between Right. Now, Christopher, you asked a great question. You said, what is the difference between the two? And I'm assuming you're talking about health savings account and flexible saving. Now, I do know flexible savings account, you can't roll, that doesn't roll over. And that's more control with your employer with the flexible savings account, where the health savings account, it rolls over. You're able to contribute to it. And then, like, let's say, for example, some companies will say we'll match you for every dollar you put in, we'll match you $2 or something like that, um and then that's how you'll have that and you get your card in the mail and everything. But with flexible savings account, I know you got to use that up. That doesn't roll over. I do know that you got to use that up when it comes to that. And that's why health savings account is typically what people usually typically like to do, because you got more control. You yourself got more control with that, because you also can decide how much you want to put in. You know what I'm
Right.
saying? Anything additional or anything like that. So go ahead. Were you gonna add something later?
I just wanted to piggyback on that too. The easiest way that I remember between the difference of the two is with FSA. Let's say you've decided you want to do $500. I like that 500 for some reason, but 500. You want to do $500 for the plan year. If you select that $500 with FSA, that $500 is already there. It's there on your card. You're ready to
Oh
go.
yeah.
You
Mm-hmm.
decide $500 with your HSA, you have to pay it each paycheck, and build it
Okay.
up.
Mm-hmm.
Um,
Mm-hmm.
Now, when it comes to FSA, it really depends on the company too and what they choose, because I think the government, and then this is just recent, I'm talking about between 1 to 2, maybe 3 years ago, where you can roll over FSA now because I have an FSA and an HSA, which
Oh, okay.
you couldn't in the past. You
Mm-hmm.
could have one or the other because of the government's involvement and stuff like that. But now I have an FSA and an HSA, and my FSA rolls, but it stays in the FSA. It doesn't roll into the
No, it won't
HSA.
work. They're two separate. Yeah, they're two
So it stays.
separate. But yeah, well, that's good to know because I know one time they wouldn't let you roll it over. I know the HSA you could, but I didn't know what the FSA they changed. So, and that's good also because a lot of this COVID stuff has caused, a lot of healthcare is ever changing and evolving. So that's why it's also just good because I didn't know that. So thank you for the
Mhm.
information. So that's
Yeah,
why it's good to
when it's time for open enrollment and you have that open enrollment person there, ask every
right.
single question that you can think of. Start thinking now because open
Mm-hmm.
enrollment is starting to come back around.
Yeah,
So
October.
questions, write
Mm-hmm.
them and say, hey, what about this? Because that's what they're there for. They're there to
Yeah.
help you choose the best plan for you.
Right, right. And definitely and just read, you got that's what I'm saying. You gotta it's just certain things if you feel like you need it or whatever you're going through, that is how I determine what option I select as well. I'm grateful to be at an employer where listen, I ain't got to put none I ain't got I could add HSA, but how much they give us is so much. I'm good. And the
Mm-hmm.
benefits is the bomb. You know what I'm saying? This is the first time, 44 years old. This is the first employer where I've been able to have the flexibility, but the bomb insurance. You understand what I'm saying? I mean, I ain't never paid as much as I have and paid as less as I have at with this particular company. You know what I'm saying? So definitely it's been very helpful and I'm blessed to have that opportunity now. You know what I'm saying? So yeah, so definitely those are pretty much, the with the differences with the deductibles and the co-insurance. The takeaway from this is just make sure when it's time for you to do enrollment that you're reading, you're asking questions. Let me tell you something, when the benefit person come and they say, ask me questions, y'all. Come on, ask questions. If you don't feel comfortable doing it, then write some stuff down and send them an email. Call them later, but just make sure you talk to them because once you get what you get, you can't change it unless you get married. There's been a change, like you had a baby or something like that, or adopted a child. You need to know that too. You need to know what the lifestyle changes, what's covered under lifestyle change. That's something else you need to ask because you can't change if you ain't had a certain thing that falls in a certain category for a lifestyle change. Those are just the ones I know off the top of my head. Most of the time, once you got your insurance, that's it until it come back around again. Yep, you stuck for the whole year. That's it.
Yep.
Okay. And also, I would say for the Medicare population, okay, make sure that you're picking plans that have and typically they do, but just in case, make sure you're picking plans that have I'm about to say vitamin D. My God, today, Lord, don't tell nobody, Father God, don't tell nobody, Lady Suspense. I was getting ready to say, make sure they have vitamin D.
Yeah, I won't tell nobody that.
Part D, y'all. Okay.
Yeah.
Part D is your prescription coverage, all right? So make sure when you sign up for these Medicare Advantage plans, and these Medicare Advantage plans was held by all major insurance companies, okay? Look at what Harvey. Girl, I'm about to say vitamin D. Make sure they got your vitamin D. And I was going to say it with such strength, determination.
The chest.
Yes. My
Vitamin
God.
D. Vitamin D. Vitamin D.
My God. My God. See? So that's why I had to catch it and breathe, take it away, get over. Okay, that's what I was doing in that moment, y'all. Say it again. Let's say it again, lady.
Vitamin D.
Say,
Vitamin D.
say, I had to catch it and throw it out. The door's this way, y'all. The door's this way.
Yeah, there you go.
Okay. But anyway, let me stop, Lord, my God, today. But make sure that you have those, that you're looking into those plans too. Because I'm gonna tell y'all something. Some of y'all the population Crystal.
Scroll on vitamin D. Scroll on vitamin D.
Yes, God. Yes, God. My God, Crystal, don't make me shout, Crystal. Don't make me shout. But make sure. My God, today, y'all something else. But make sure that you know those different parts to the Medicare. Okay, especially making sure that, because if you select um if you don't select a Medicare Advantage plan, let's say you go what your state offers, you got to pay additional for Part D. It don't come with it. You got to pay additional, okay? Some people may qualify for Medicaid and Medicare, all
Mm-hmm.
right? Um, some people may even have a commercial account, but depending on what it is, they because of their income, they may qualify for Medicaid. But Medicaid is going to be considered secondary to your primary, okay? So just make sure that when you're selecting these Medicare Advantage plans, that you're also looking to see, what you're getting for that too. Because I worked in Medicare and some of y'all was mad. I used to be like, Lord, have mercy. I don't want to disrespect nobody, my elder, but my God, today I need you to read and make sure you understand, okay? So definitely utilize that. Something else I want to say too, a lot of these insurance companies have case management programs. They have diabetes programs for stuff like that, for oncology case managers, maternity case managers, various different things like that. So definitely, look into that too. Because even as an employer, and I work for case management for my job, depending on the situation, I can also have a case manager because, I'm saying, because I'm still considered a member of the insurance that I'm paying for. You know what I'm saying? So just make sure that you also are looking into that as well. Because I know United Healthcare, they have some good services when it comes to that. Because my mother has a case manager, and every so often she gets a certain amount of where she has a booklet and she could pick out what she wants. She gets a credit and she could pick out whatever she want and whatever she might need out that book. It could be over the counter medication. It might be a blood pressure cuff. It might be a thermometer. You know what I'm saying? Not thermometer, Lord. Is that right?
The mama take the temperature.
Yeah, that's right. All right. Ooh, I thought I said thermostat. But anyway, so it could be it could be, yep, meds, equipment, yep, sure can, y'all. You know what I'm saying? So, look and see. I know United Healthcare offers that, and I know Humana because I used to work for both of them. Okay. So definitely, wow, you gonna stop? Lord, look, and I'm seeing you look at Lady Smith like, wait a minute, did I say that right? So
The mama.
definitely, and I did eat, y'all. I did eat. So y'all can listen. Can I get a little clap for that? Can I get a little clap for that? Huh? Can I get a little clap for that? Hey, I ate today. Okay. Yes, God. So I'm good. Okay. Now I might have took a half of a gum, but y'all already know, ain't nothing wrong with half a gum, half piece of a gum. Okay, y'all know how your mom used to cut the spearmint juicy fruit, big red. That's what I did with the gum. Okay, yes, God. Ah!
Ah, no
So
wonder.
definitely make sure that you all are doing that as well. Make sure that you're looking into that. Something else for Medicare patients and Medicaid. Well, Medicaid gives you a lot more things, to be honest. But with Medicare, see if you got coverage for like transportation. That's something to look into. You just never know. You know what I'm saying? You might need it or something like that. Um, I always say when you're looking to select the insurance you want, always do, okay, this is what I'm gonna do for what happened last year, but what if? It's nothing wrong. It's not saying you're trying, it's not like you're putting it out there, but what if? You want to be covered. So you always think about, well, what if? You know what I'm saying? So when you're reading the benefits and you're seeing what's covered, just think about it that way. Now you still may decide I ain't gonna worry about it, I ain't gonna do it, and that's cool. But I'm saying just look at it that way too, just in case. Oh, it's nothing wrong. There ain't nothing wrong with being a just in case. You know what I'm saying? So definitely that would say those are just some of the things to look into as it relates to that. Yes, especially with kids. especially with kids. Um, and what was I gonna say before Ansley said something about the kids? Let me see. What's something else I was gonna say? Lord, it's gonna be good too. I'm trying to think.
Gummies kicking in. Gummies kicking in.
Woo, Lord, let me see what I was gonna say. Ansley, let me see. I said a flag. Oh, I know what I was gonna say. And also, when it comes to, I sound like Maury, don't I? When it comes to, okay, and also, yeah, they're gonna be about the gum, that half a gum. Dear God, when it when it comes to blood glucose, blood the machines, blood pressure cuffs, okay, take them to your doctor so that they can calibrate them. All right, because sometimes you don't need a new one. Now, sometimes you may. And what I mean by calibrating is they're resetting it so that it's not giving you a false positive or a false number that really isn't accurate. Okay. So definitely a time here and there. You see what I'm saying? And when you go to the doctor, take your blood glucose monitor. I mean, your blood glucose monitor. Take that with you. Make sure you take your blood pressure cuffs and let the nurse recalibrate it so that it's ensuring that it's getting the right blood pressure or blood glucose reading. Because what you don't want is for something to be off, something showing less than what it is, and the next thing you know, a situation occurred because it's saying this, but really it's that. Okay, so definitely make sure that you do that. And what else I wanted to say? God, what else? What I was gonna say? It was something else I was gonna say. Oh, and when you go into your doctor's appointments, all right, something you want to do too is make sure that you bring your medications with you. Okay. Um, Something working in, I've worked with Medicare population for a long time. And a lot of times when you are going to these different doctors, they don't communicate with each other. So they don't know what the left hand don't know what the right hand is doing. So it's very important that you have to let them know. Sometimes they may use Epic, which is a national, international system, medical record system that a lot of people use. But the thing with Epic is it ain't always. Epic got different packages. Okay, everybody ain't paying for the high class Epic. Some people just want the basic. So in that case, they may not be able to transfer different information from one place to another. So that doctor might not know that you just went over here to see Dr. Phillips, who's your oncologist, who done gave you this, and this, when the doctor already done gave you that. Keep in mind, y'all, different medications treat some of the same stuff. So you want to make sure that you're not taking medication that's called polypharmacy. And you don't want that to happen. All right. You do not want that to happen to where you're taking, because that can be detrimental. So always remember to take either a list of your medications or take the medication with you. All right. A lot of y'all got parents in the sky. I'm talking to somebody right here in this area right here. There's a few of y'all. Okay. You got parents and they just y'all ain't putting them in no pill bottles or just everything in a grocery bag, a Dollar Tree bag, and it's okay. That's okay. All right. But you need to make sure that Dollar Tree bag is going with y'all when y'all go to the doctor's office. All right. The Dollar Tree bag need to go with you because you want to make sure that every single doctor that your parents see, your parents might see an orthopedic, a podiatrist, endocrinologist, a cardiologist, a pulmonologist, or whomever, all the gists. They need to be taking their medications every time you go to the doctor so that this doctor know what this doctor over here is doing, because doctors do not communicate with each other all the time. All right? So please, that is so important, y'all. And I'm saying this because I'm serious. Please, because for some reason, doctors give older adults stronger prescription medications. Okay? I'm just saying they do. And what you don't want is for one doctor to have gave your mama Viking and 5 something, 23, 25. But this doctor over here done gave your mama 10, 325. And your mama taking both. You understand what I'm saying, y'all? I'm serious about this thing because it can happen. A lot of these medications, whether it's whether it's some kind of blood pressure medication, it could be it could be something for the nerve, for your neuropathy or whatever the case may be, like Lyrica, those kind of things. A lot of times these medications, antipsychotic medications or whatever, they they cause another. When you have medications that are considered like narcotics or benzos or those type of things, antihistamines and stuff like that, they cause the intertwine, even antiemetics, those type of medications that help with nausea. Not Zofran. I'm talking about like Finnegan and stuff like that. When you mingle them together, they intensify the effect. So one medication may have you a little loopy, but then when you add another one that's in the same category, it's going to have you even loopy. So then you go to mama house, mama ain't opening up the door. So then you knocking on mama window, she ain't answering. Then you go in mama room and she knocked the hell out and she delirious and she drowsy as hell. She can't keep awake. If you go into your parent house and they can't keep awake, it's something that ain't normal. Get them checked. So it's very important. I'm gonna tell y'all something else, and I know I may go over 7 o'clock, but I feel in my spirit I need to let you guys know this because somebody need to hear it. I think it's important too for people to start using pill packs, especially if you're someone that takes 1,000 medications. Because with pill packs, they're going to separate everything for you. You don't have to worry about having a pill box here and trying to remember, telling mama to remember to take this. Y'all know when we get older, everything slow down. Your memory slow down, your taste and tongue slow down, your hearing, your vision, your movement slow down, okay? Mama might not remember that you said that you put this over here and that over there. Daddy might not remember that, or uncle, or whomever it is. Find out from your pharmacist, local pharmacists, because some of y'all using these outdated pharmacists that ain't never been, that your mama been seeing since 1925 and they still open. Now the family done took over and they still using the same dollar machine for cash. They ain't got no kind of stuff. I'm saying it's still some of them hick towns now, some of them hick towns still got used in the mom and pop pharmacies. Ain't nothing wrong with it. But the mom and pop pharmacists might not be doing the trick. So you want to make sure that pill packs is something that's very helpful to see if your pharmacist offer pill packs. And what they do is they'll separate everything for you, and it can make it a lot more easier. Yeah, they haven't that's right. Modernized it. That's right, Ansley. They have it. You see what I mean? And then the person who was the pharmacist, who was your mama pharmacist, still the pharmacist. He about 95, still walking and whatnot, taking 10 years to get to the stuff. You've been up. I'm just saying, some of these places still have some old peoples. That's the pharmacists. They don't want to give up the job, you know? So definitely, I will, Christopher. So definitely hear me. So definitely make sure that you are, you asking those things. Y'all got to ask. If you don't, see, this is the whole thing. If you don't know, how you going to know? If you don't know.
Right.
I'm sorry, y'all. Let me put my little thing on there. How you gonna know if you don't know? I might be a little tilted, but that's because I got the charge in there. So you got to ask the questions. Okay? Hey, 702. Hold on, am I looking right? Am I good, y'all? So you want to make sure, okay? You want to make sure that you are not only advocating for yourself, but you're advocating for your loved ones. Okay, it's just very important. Advocating for your loved ones. All right, don't forget. Make sure that and advocate and speak up. The doctor, you ain't understanding something. Let me tell y'all something that's just a pet peeve of mine. When I done set a scheduled appointment with a patient to go see the doctor, tell them what to say, and they don't do it. Then they come and they ask me, well, what you think about this? Well, why didn't you ask them? Why didn't you ask your doctor? You was there. When we talked about this. You know why? Because there's a certain thing called initial, right? There's certain things that, that I might not can't educate on. For example, surgeries. That doctor is supposed to explain every single thing that's supposed to go on in that surgery.
Yeah.
Okay. That doctor is supposed to explain everything. You having a total knee replacement or something like that. That doctor is supposed to explain that information to you. And if you call me and say, I ain't understand something, you know what I'm gonna tell you? You got to go back to your doctor, sweetheart. That's the doctor's responsibility for you to understand. But you got to make them remember, Christopher. You got to make them remember. Okay.
Saying beforehand.
That's right. That doctor, that doctor, you gotta. That's my thing. Something I say all the time. I am not going to make you dependent. You are going to remain independent. And so, in a way for me to have you remain independent is to motivate you and encourage you to get involved in your health. That is what I say to my patients, that I have. You got to be involved in your health. You can't reach me. Call yourself. Get to know your doctor. You may not have a good you may not even have a good relationship with your doctor because you ain't talking to him. You want me to call all the time. I'm not doing it. Okay? You need to be able to go ahead and call your doctor and be comfortable enough to ask the questions that you need to get the answers that you need to help you. Period. Period. You have to get involved in your own health because, again, the same thing I say about the pathophysiology of a condition, knowing what makes that up. What causes hypertension? What causes high cholesterol? What's causing the diabetes or the COPD or whatever type of health condition you have? You have to be willing to learn and understand what it is, because when you do that, I feel that you'll be more involved in your care. You'll be more once you understand what's going on. And so I always ask my patients, tell me what you know about hypertension. And when they tell me what they know, I'm like, wow, that's a lot of information. I'm glad, you know what I'm saying, you really embrace the information. Can I tell you a little bit more? Can I tell you this and that? I always ask permission because I'm going to continue to let that person have their dignity. And I'm going to allow them to build that trust to let them know I'm working with you, not against you. Okay? It's always the way that you do. Again, this is a part of motivational interviewing. It's a skill. Just like conflict resolution, quiet as it's kept, and contrary to popular belief, I am certified as a motivational specialist, advanced care planning, as well as what is it? What I have to say? My God, today they have done me is something else. Conflict resolution skills. Okay, your girl, listen, I don't play. Somebody tell me it's something going on, they got a member, something going on, somebody cursing, somebody doing something. I love it. Bring it on. Transfer them. You see? By the time I'm done, we're going to be best friends. Y'all already know. Y'all already see how I am. Uh-huh. But there is a tone, right, Lady of Suspense, because you heard me one time. There is a tone where you go from here to there. Okay? You got to. All right? I'm going to teach y'all that move one day. Okay? So I just want y'all to just, embrace this information that we provided. Thank you so much, Lady of Suspense, for coming on and explaining those different pieces, even explaining your own personal health and, personal family situation as well, because, you didn't have to do that. So I appreciate you for doing that. I definitely do. Thank you so much, Anthony, as well, for throwing your, I wish you was up here too, because you could have been, you and Wild Harvey, because we all have knowledge of this. You see what I'm saying? I'm your best friend, Christopher. You my best friend too. Best friends to the end. We are best friends.
Gotta do the color purple.
Me and you will never part, my Tiana. Keep my sister away from me. Yes, God. Mama Mia. Mama. Time. Mama Mia. I'm just saying. Don't do it, y'all. Somebody in the sky saying something, she ain't got to do all that. Now she taking things too far. I ain't took it far enough. I took half of a piece of gum. Okay. So definitely, like I said, just I'm hoping this information was insightful for everyone because, and this is something that I've done in the past. This is something I'm going to continue to do, and we'll probably take a deeper dive in some of the other, like lupus is something else that I would like to, discuss and get into. Sarcoidosis. These are just some of the more I think they're becoming more common, but they're not as common as some of the other things like COPD and those things like that. But there's just various conditions and everything that I would love to get into, and have, if there's a topic that you all see that may come up as an event on your FYP page, definitely reach out to me if it's something that you feel you would like to speak on, you would like to educate, or just have a discussion about, okay? Because I just feel that once, when you went through something, you have more that keeps you from being a beginner, right? Now that you went through something, it goes from being a beginner to being intermediate or being actually a professional at what you know in regards to education. Knowledge is key. Always remember to use credible resources, but most importantly, please go to your doctor. Okay, please consult your doctor. People who are in the healthcare field, we tired of family members and friends asking us questions and calling us every time something going on. Okay, we sick of it. I'm speaking for the whole community. We sick of getting the phone call, girl, such and such. This came and this did this, and then they hit their toe, but then the toe was this. What you think that is? We sick of the calls, okay? We ain't doctors, okay? Now I just want you to know, we tired. Go to your doctor. Call your doctor up. Call your doctor up. Also, find out when you go to your doctor if they have an on-call service. So when your doctor ain't available, somebody's on call 24 hours a day. And also, when you sign up for benefits with these huge organizations, they also have nurse lines. So ask about that. All right. 24-hour nurse lines. Now, granted, the nurse, we're not here to diagnose. That's not what we do. We can't do that. That's out of our scope. However, we treat symptoms. However, we can give information based on approved protocols from a doctor, but we can't tell you or diagnose you. That's not what we nurses can do, okay? But definitely we can give you evidence-based information based on the symptoms that you might be having or questions and things of that nature, all right? So just definitely do that. This is I'm in my element when I talk about this stuff. You know what I'm saying? Well, when I talk about anything, but this is really, I'm in my element because I love what I do most of the time. Most of the time I love what I do, so definitely, and it's a blessing to be able to be, I'm just grateful to be employed and be able to have the mental capacity, the knowledge, the skill to help those that need assistance. Okay. And I'm going to continue to do that. All right. I'm sorry. My plan was to go on Facebook too, but for some reason, Facebook just wasn't doing right for me on my laptop. So that's what happened with that, but it's okay because the good thing is with TikTok, I can download this and add it on Facebook.
Yeah.
So,
It's all
it's
good.
still, yeah, right, right. See that? No stressing. God is
Yeah.
too good for us to stress or fear. So that's exactly what I'm going to do. And I'm about to shut down because, I had to use the creditable resource with my employee and things because I don't play no games when it comes to that. So, yeah. So, any questions that anyone may have at this time?
Watch
You're
dog.
more than happy to put them in the. Let me put this light on because I can't even see. Ooh, Scott, I gotta put my trash and stuff out because trash day tomorrow. Any questions or anything? Anything may have any questions? Mm-hmm. Don't seem like it. Oh, I'm sorry. And I also want to say thank you again, Boo for Life, for sponsoring this live. Please check her out. One Nubian Queen Accessories. You can follow her on Facebook. and she's on Facebook every Wednesday at 7:30 p.m. and she sells her jewelry there. This is what she actually blessed me with. This is a butterfly ring, and it has like the band in, so it's not tight or anything like that. Also, this necklace is one of those, not necklace, this bracelet is one of those clamp bracelets. So I just put my hand in and, oh my God, today. And it comes on and it do what it do. These beautiful earrings, she actually sent as well. And I like them because they hang, like, you know what I'm saying? So they cute. And this beautiful necklace, butterfly
I,
necklace as well.
I really like that.
Girl, yeah, they nice. And I think her items are $5 a piece, I believe. Some things is a set. So this was actually $5. So listen, and it's nice. Very, very beautiful. Prepare to see these often because she sent me so much, y'all. She sent me so much. I was not expecting this. So I appreciate her. And if you would like for me to advertise your items or anything like that, please look at my bio and you can send them to the P.O. box and I'd be more than happy to advertise it with my clothing, and everything like that. So please feel free to do so. Ansley, you said, how should a patient document if a doctor refuses to treat a concern? I always recommend chain of command. So when now okay, if the doctor is in a group setting, like let's say he's in a group practice, there's an office manager or someone like that, I recommend speaking to the office manager and having that discussion. And that could be something that is, documented with you speaking with that, collecting the names and people you spoke with. But if that's a private practice, then the next step is going to the looking that doctor up and filing a complaint with the Board of Medicine. That's what you'll be able to do, because when they own their own practice, there's no they're up top. That's it. You know what I'm saying? So definitely just report them to the board of medicine, and don't be afraid to do so, because is no one should be feeling as if they're less than. Especially when you're in pain or you're going through something, the last thing you want is for somebody to talk down to you, feel degraded, feel less than, or whatever the case may be. You ain't got time for that. So those would be the things to do, but I would first take the first step in speaking with an office manager. And typically in those larger practices, they have like an office manager or someone like that. So that's a great question. Thank you, honestly. Thank y'all so much for following me. I appreciate that as well. And for coming in and coming through. Do know that shop at she-say-he-say.com is still in effect. Yes, God. Yes, it is. The Dior, the Burberry, the labels, sweaters is coming. They're on their way. And also, I have a huge summer sale at she-say-he-say-boutique.com. Everything $5, okay? Huge summer sale. Yes, God. Now, you say, why that low? Well, it's a liquidation. Look it up. Google liquidation. Put in the phone. All right, what's a liquidation? Okay. I got plans for She Say He Say Boutique. Everything must go. Same way places go when they want to get rid of something or whatever the case is. Everybody do it. They may not do a liquidation now, but all major clothing lines do it. They have a sale to go into the next, because you're trying to get rid of the summer stuff going into the fall. All organizations do it, y'all. Okay. So definitely, yes, the labels are coming. Yes, God. When I can't wait till they do they en route. They en route. Is it route or route?
Right, on the way.
They're on the way. They're on the way. Okay. So definitely, I cannot wait for that. With the handbags as well, because I did order some more handbags also. But if something is sold out, definitely, I hope people can find other things that they may like. That they like. Oh Lord. That they may like. Okay. So yeah, Shop Pay and Amazon Pay. Well, no, wait a minute. Shop Pay is $50. Okay, you got to spend over $50 on shop at she-say-he-say.com to use the Shop Pay to split it up in 4 bi-weekly payments, which equals to 2 months. Amazon Pay is, if you have an Amazon account, it don't have to be over 50. You could just select Amazon Pay and that'll go on your Amazon card. That's what that is. So it's pretty much giving a leeway to be able to shop with your Amazon card at different places, So yeah, so that's what that is. But thank you, love. No, you're okay, Ansley. Thank you, because you brought it up for me to be able to say something about it, so I appreciate it. No problem. So yeah, so this Shop Pay is available for Shop and She Say He Say. It's not available for She Say He Say Boutique. But I mean, come on now, $5. I mean, I'm just saying, gosh dog. Well, I mean, and I still got 2-piece sets that are cute, short sets. All of those great things. The 3-piece suits, $5. You see, so and on Shopper She Say He Say, I have the dresses and the jumpsuits on my website, and I did mark those down to $5. So even if you go to Shopper She Say He Say, you'll be able to see some of those items. But all of the items for the summer is at She Say He Say Boutique.com. And I have been advertising, so I know y'all seen it. Prepare to be sick of me, because that's what I do. Okay, that's what I do. My God, today look like it's already getting dark outside. It's 7:16. It don't make no sense. But I forgot it's getting ready to change some things. So yes. But I don't think it was any other questions or anything like that. I thank everyone for attending. I really do. I appreciate it. Ooh, I appreciate it so much. Um, I'm so glad tomorrow is Thursday, 2 more days to Friday. I cannot wait. Also, and also I'm adding, nice little when the men's ain't no men's clothing coming, Christopher. Ain't no men's, ain't none. I'm not doing men's at all. That's another. I gotta master the women's stuff first and do things, like that. So it may never be a men's. I may never do that. I did it at one time, but I may never do men's. You know what I'm saying? But thank you. That's a great question. That's a great question. No question is a bad question. Okay. One question is a bad question. All right, not okay. Wow, Harvey, no problem. But yes, yeah, so anything else? Anything else anyone wants to say or anything? Wow, Lady of Suspense, anything?
No, not really. Other when I get off here, I gotta work on my script.
Okay.
Yay, yay, fun, fun, fun.
Yes,
But
God.
I'm almost done with it though, so just
Mm-hmm.
just time fine tuning and making sure these lines make sense, and then we'll be ready for the table read in 2 weeks. I think it's the 18th. So yeah,
Mm-hmm.
rehearsals and stuff like that. I'm looking, since we were just talking about men's clothing. I'm trying to find some suits
Mm-hmm.
somewhere. Suits, because the characters are lawyers, so I need some nice
Mm-hmm.
looking suits. And let's see, I need 3, 4.
You
Four.
should reach out to you should reach out to some of these men clothing places and just see if they do anything like that. Like do like as part where it could be more of an opportunity for them to
Mhm,
where you can showcase their clothing in your
mhm.
movie. You see what I'm saying?
I tried to reach out to one and they never got
Mm-hmm.
back to me, and I was like, maybe I should try it again and
Mm-hmm.
see what happens, or just figure
Yeah.
something.
Yeah, I would try again and see. Even if they're not even in the same state as where you are. I'm sorry, y'all. It's dark. It's about to get dark, and I got to pull my trash cans around for it get dark because I don't do the darkness. I don't do the darkness. My God, today. Mm-hmm. Because last year, I remember when I fell. I don't know. Some of y'all might know. I fell down these damn stairs, and I ain't trying to do that. I'm not trying to do that. So, but yeah, you can. I would definitely look into that and see what they say. I sure
And
would.
any companies down there in Tennessee,
Let me take them.
because we can always mail stuff, and if they want it
Yeah,
back,
right. That's what I'm saying. Sure
not gonna,
enough.
you know. Yeah, that would be
Yep.
great.
It's
That,
cool out here. Right. So I would definitely look into that. whatnot. It's cold out here. Mm-mm. I don't do the cold. My God, today. Hold on, y'all.
Yeah, I was just talking
Y'all
on
see them?
Inslee's Facebook post about how cold it was here this morning. Brennan had on
Right.
a winter. I said, I don't want my baby out here shivering, so get your little coat on. So,
Hold on, y'all. I walked through the damn bush just to get out here.
what in the
Okay.
world?
Huh?
What
Girl, that
happened?
damn tree. Ooh, the damn tree. Oh,
I just have to look
look at it.
and I'm like, what are you doing?
Yeah, I gotta get the guy to come cut it because it's too much in the way. Girl, yeah. Hold on. But yeah, oh, somebody got their lawn service thing right there. But yeah, so but anyway, ooh, girl, I'm going through y'all. This the Wiz. You can't win. Ooh, can't break even. Y'all know I talked about the Wiz.
Mhm.
Don't make me start skipping in this backyard, Lord. It's trash. I'm about to throw all this in here.
Okay, Ansley, I sure will. I sure will.
All right, y'all. Well, I'm about to get ready to go myself because I got to let this phone charge up. But thank y'all so much for coming. I appreciate it for coming through
Thank you for
because you
having
didn't have to. And you're welcome. And I'll holler at y'all later.
me. All right.
Bye, y'all. Love y'all. Bye.
Bye.